Hi, everyone. Welcome to the podcast. I am your host, Dr. Scarlet Spain. I am an occupational health nurse practitioner, healthcare consultant, assistant professor, and DNP program director at Valparaiso University. So welcome to the podcast. Our objectives for the podcast today is to chat with one of our recent alum about his practice. So I want to find out who he is, the role of the family nurse practitioner or FNP, gather any thoughts he has for new grads as they transition to practice. So looking from that RN role to the FNP role, and just kind of see how he's doing after graduation. So with that, our incredible guest today is Dr. Nick Davidson. So thank you so much, Dr. Davidson, for speaking with me, and welcome to the podcast.
Thanks for having me, Scarlett. Thanks for the opportunity to talk.
Yeah, we're excited to have you here. So with this, we're going to go ahead and get started. Nick, can you start us out by giving us a brief rundown of who you are and where you practice as a nurse practitioner?
Sure. So like Scarlett, like you said, I'm a recent graduate of the Valparaiso University DNP program. I graduated last spring in 2022. I live and work in Indianapolis, and that is where my practice is located. I work for the Ascension Medical Group at St. Vincent Hospital in Indianapolis.
Awesome. So I do want to dive a bit deeper with you, Nick. We're going to start way back when. So can you tell me about your aha moment where you knew that you wanted to be a nurse?
Yes. I would say it started probably in high school. I knew right away I didn't want to go into any type of business, or I didn't want to sit at a desk all day, or I need to be moving. I'm a very active person. I was always interested in science and anatomy and physiology. So that's kind of, I would say, was my foundation for becoming a nurse. And then on top of that, I am a very faithful person, going to parochial school my whole life. I tell people I try to be a good Catholic boy. So I was always raised to try to look out for other people and try to care about other people. So I think the combination of those two things is what kind of led me down the path of looking into nursing. And then specifically looking into Valpo, I had an opportunity both through academics and through athletics to go to Valparaiso University and do both. I was able to play basketball at Valpo and go to nursing school, which, if you know anything about either of those two programs, they're both one of the best two things about Valpo, in my opinion.
Yes.
So I felt very fortunate to have that opportunity in both areas. And I think when I started my nursing journey, I always had a thought in the back of my mind that I wanted to be a nurse practitioner. Even when I was going through nursing school, I think becoming a nurse was a great goal, but I always set the bar to become a nurse practitioner.
Very cool. That was kind of another question I had. So you did your undergrad at Valpo, played basketball for Valpo. Super cool. And you're right, that had to have been, how did you manage doing your schoolwork? Because both are really demanding. And then also being an athlete. Any little tips there for people? How did you manage?
I think it's just having your priorities set in terms of what you want to accomplish. There can be a lot of distractions, right? Not just in school, but in life. But I approached it as, what am I here for? What am I doing in this moment? And what are my goals in life?
Mm-hmm.
And that was number one, to be the best basketball player that I could be in terms of trying to reach the NCAA tournament, or, win a certain amount of games, help my teammates in any way that we could. And then on the other side, in nursing, it was always, preparing myself to graduate from Valpo, but then be as prepared as I possibly could to pass the NCLEX and to start my nursing career. So I tried to stay as disciplined as I could. when I was in school, and that just kind of meant just making a schedule every day. I have class from here to here. Okay, then I have practice from here to here, and then after I'm going to go to the library from this time to this time, and just a lot of preparation beforehand, and then being disciplined to stick to that plan was kind of how I got through it.
Okay. And then did you work as an RN after you got your undergrad? Did you go straight into FNP school, or what did that look like, that transition there?
No, so I wanted to get some experience as an RN before going right into nurse practitioner school. I had a great opportunity to work in cardiology as a nurse. So I kind of jumped on that and started kind of on I would say a telemetry unit where I took care of patients with chronic heart conditions, acute heart conditions. I did that for about a year, and then and just kind of talking to people that I worked with and doing some research on my own, I knew that I needed some type of intensive care experience to really kind of help grow my skills and my critical thinking as a nurse. So I was able to get a job a year after working on a telemetry unit in the cardiovascular intensive care unit. And the hospital that I worked at was a great opportunity because it's one of few hospitals that does heart transplants, and we do things called left ventricular assist devices. We have patients on ECMO, which is extracorporeal membrane oxygenation, we could do a whole podcast on that. So it was a lot of interesting types of things that we did at that hospital that helped me grow and learn. And it being a teaching hospital, it allowed me to ask questions of the physicians, ask questions from nurses who are older than me, to get more and more experience and get more and more education. And then finally, I felt like I was at a point in my life where I didn't feel overwhelmed going into nurse practitioner school. I felt like I had a good enough foundation to start my journey. And I think having such a great experience as an undergraduate at Valpo, it was really a no-brainer to say, I want to go back to Valpo because I had such a good start to my career that I want to continue this.
Oh, I'm so glad to hear that. With that, so go ahead, because I don't know if you formally told us what your job is now. So go ahead and tell our listeners where you work at as a FNP now.
Yeah, so I work for the same hospital system. It's St. Vincent Hospital system in Indianapolis, Indiana, and I specifically work with our heart transplant and LVAD patients. So that means that I see patients who just routinely come in for just like follow-up and just kind of see how they are doing with their fresh transplant or with their LVAD, answer any questions that they may have or anything that may be going on with them. But on the same time, I also see patients who have advanced heart failure and who are doing okay on guideline directed medical therapy, but there's kind of this in the background of, hey, you may need an LVAD at some point, or hey, you may need to be listed to get a heart transplant at some point. So that's kind of my practice, and I've been doing it now for 7 or 8 months now. So
incredible. So incredible. I mean, that nurses, no matter, because we work in so many different places, and we're always making an impact, but I just really love your story and what your specialty is now. It's very, very cool to me. So, I'm probably passionate about it. My grandfather had a heart transplant. This would have been late 80s. I mean, I kind of remember it, but I was small. So yeah, I would say late 80s. And gosh, he lived until 2009, I want to say. Maybe it may have been 90s. early, if it was a heart transplant in the 90s, it was very early 90s. But yeah, so I just really love your story again, because it is something that's personal to me. So very, very cool. So you kind of told us the kind of patients you see. What does a day in your life look like? And I know days are always different, so that's always a difficult question to ask, but what is a day in your life as an FNP working with transplant patients and heart failure? What does that look like?
So I work 4 days a week. I work from 7 in the morning to 5 o'clock at night. And then 1 weekend a month, I have to be there on Saturday and Sunday from 7 to noon. And my day kind of starts with just seeing the kind of patients that I'm going to see. I usually get to work 30 minutes to, quarter till I'm supposed to start, and just kind of see the kind of patients that are going to be coming in to see me.
Mm-hmm.
And it could be, a transplant patient who has nothing wrong with their heart, or there's nothing wrong with them from that standpoint, but they have, diabetes, and their sugars have been kind of out of whack at home. So
Right.
sometimes they'll come in and see me for something that's not even related to their heart transplant. And so just kind of seeing, so it's not just that specialty that I get to work with, but I also get to work with a lot of internal medicine
Right.
types of things too. So that part is something that I didn't really expect, but it's been kind of a bonus for me in terms of being able to grow in other aspects just outside of my very special situation. So that's kind of my day. I usually see in the morning, it's pretty set on the patients that I'm going to see. And then if someone needs to come in for like a sick visit, or a physician has to go somewhere or go out somewhere, they have something come up and they have patients that they have to see in the afternoon, but they can't see them, I go and see those patients as well. There are, outside of me, there are 4 other nurse practitioners that I work with, and then there are 8 physicians
Very
that
cool.
are part of our group. So it's a fairly large group,
Yeah.
but it's a good group in terms of I have been welcomed with open arms.
That's awesome.
And I know this is something that we're going to talk about, but that was kind of one of the things that I was looking for, I guess, when I was trying to find a job, is what's going to be an environment that's going to be welcoming.
Yeah. Yeah.
And what is an environment that's going to allow me to grow and learn.
Yes. It's so important, especially, I mean, new grad, not new grad, even if people are changing, from one specialty to another, or even changing internal medicine offices to another. But I think you really hit something important. It's important to kind of gauge your situation, see what your comfort level is with the staff. And it doesn't mean that people are, that it's a bad environment. Maybe it's just not the right fit for you,
Right.
So I do think it's important that people kind of feel things out and make sure that they can get what they need to feel not only fulfilled, but in regards to teaching and onboarding and, getting the knowledge that you would need. So
Did you
yes.
kind of start that way? Like when you started your career, did you have like that type of start to your career, or was it not like that?
Yeah, I had very supportive mentors. I actually started in internal medicine, and I did that for close to a year. And then I went into occupational health at a large industrial company, and I spent 10 years there, or it was like 9. But super supportive collaboration with my collaborator, which was awesome. And we had one full-time RN. She had been there for 20 plus years when I had started. So she definitely knew the ins and outs. Occupational medicine, not only are you treating patients, you have like a lot of involvement with the company. So that was a specific company I was working for. So in regards to, we're looking at a lot of prevention. So if somebody comes in injured, we are treating that patient or those people that are injured. And then we're also looking for ways to prevent that from happening in the future. So it was a really cool environment, meaning that I literally had steel-toed boots in my office and would put those on in greens and go out to injury sites and see how how we could change the environment to prevent what if it was a trip hazard or whatever. If it was something simple like a cord, over the floor, you move the cord, but a lot of times it would be something more involved or looking at the complete picture. So that was cool. But yeah, I definitely feel like with my transition into practice, I did have great support, great physicians that I was working with that were great teachers. And that was really, really key for me. So yeah, it's an important thing. And you have to also be comfortable asking questions, right? Because we come out of practice and we're ready to practice, we're excited to practice, but you have to know your limitations and knowing what you don't know and what you need to find out more about. So yeah, I would say we had a nice transition to practice as well.
I would totally agree with that. I think don't ever be afraid to ask a question. Whether you are an undergraduate graduating or you're in graduate school and you're graduating, never be afraid to ask a question, because I know I'm just starting out. I ask questions every single day, but I also know, the most senior practice providers that I work with, they're always asking questions. So and even the physicians that I work with, I think that they're some of the smartest people I've ever met in my life, but they're always asking questions. They're always trying to better themselves, and they're trying to better themselves because we're trying to provide better care in the end, right?
Yes.
So don't ever be afraid to ask a question, whether you're asking a nurse or some other type of discipline. Use your work environment as another school, pretty much. Use it as an opportunity to continue to learn and continue to grow, because that's how you're going to get good.
Yep, for sure. And that's just it. Medicine and nursing, they're they change because of guidelines and finding better ways to treat people in certain conditions. So they are always changing. So that's another thing too. And I know people say this, but nurses really do. And nurse practitioners really do have to be constantly seeking out information. It's up to us to find out if what we are treating, if this is still the guideline, if we haven't looked at it in a while or whatever. Our assessment skills obviously have to be on point. And then if you don't know the information, knowing who to go to or, how you would find the information, I think is really important as well.
And that I think finding the information, I would say that was one of the things that I thought was one of Valpo's strengths. I think the school, both in the undergrad and the graduate program, I think they do a really good job of showing you how to find answers to the questions that you have. And that was something that I still continue to use to this day. I still use the searching skills that I was taught to find answers to questions that either someone told me and they're kind of unsure about, and I just wanted, I wanted data to find the answer. And Valpo does an incredible job of helping you find answers to the questions that you have.
Oh, I love to hear that. And I think it's important for our listeners too. And people who are enrolled, a lot of our listeners are probably going to be DMP students or FNP students. So they understand what we're talking about. But for other people, you can find evidence on Google searches, but you got to make sure that your evidence is from a reliable source, right? So there is there's much more about research and researching a topic than just putting it into a Google search bar, because you can really, if you had some idea, you could probably find something that states that it's valid. And even if your idea is not correct. So there's science that goes into researching, and it's important for FNPs to know, again, how to find reliable evidence when we're looking, because it's all about patient treatment and looking at patient outcomes. That's what we're looking for. And it may be individual outcomes, or it may be, groups of people. So really, really important. So that's all awesome information and tips, Nick. Another question I've got, anything specific, and you kind of already touched on this, but specific ways that Valpo prepared you for practice? Anything you can speak of? I know you already kind of mentioned some things.
Yeah, I would just say it's not just the classes that you take, but it's the people that are teaching you in those classes that what makes Valpo special. And I think I have a really good relationship with the professors just because I went to school there for 7 years.
Yep.
So knowing them and seeing the amount of work that they put into their profession as professors, and I have a very unique relationship with some of them because I needed them for help along the way and along my journey, and the sacrifices that they made for me in terms of talking to me late at night or going over to the College of Nursing and them taking time out of their day to spend with me. I can't say that another school does that for their students. So obviously the classes are great, but it's the people that are teaching you in those classes that make Valpo what it is. And I know that I am not the only one that says that. I have a lot of friends that not only went to undergrad at Valpo, but also got their DNP from Valpo, and they would tell you the exact same thing. Is it's the culture that the college provides that is what make it so unique.
Yep. I agree with that too. I don't know, Nick, did you know I'm an alum of Valpo? You probably knew that, but yeah, for people who don't know, I've got my BSN there, my MSN, postmasters, FNP, and then my DNP, and then I'm about to graduate this May with my MPH from Valpo. So I completely agree with everything he just said. And now, of course, I'm a faculty member and the program director. So there's a reason that I went back after, and like you said, people definitely knew me because I'd been there for many, many years with all those degrees. So yeah, there's a reason that this became my career now, but it is a really, really special place. And a lot of times I can't find the words to verbalize why it's special, but it's just a special place. And like you said, the professors and dean, I mean, everybody's just incredible and definitely there for student success. So
yeah, and I'm happy to see that the school is getting recognized, not just by alumni, but it's also being recognized outside of, the Valpo family.
yes.
I see a lot of reports about how the College of Nursing, how it ranks in terms of other nursing schools. And I think I see every single year it's getting better and better and better and climbing in terms of where it ranks, which isn't everything, but it's nice to see other people acknowledge that what we see it as,
Yes. Yes. And that's, yes, I agree with that as well. We are small by student population compared to some other schools, but I feel that we are very mighty, and the reputation is great. So awesome. So just in closing, any advice you have specifically for FNP students or FNPs as they are transitioning to practice? So that's kind of a hot topic that we always look at with our future graduates, our recent graduates, being that you are a recent graduate, any specific items for them going from that RN practice to the APRN practice?
I would say for students that are currently in the program, I think one of the things as I reflect on school, one of the most important things was my clinical experiences. And I know that can be challenging to find people and things like that. But if I were to go back, I would want to not devout, but put more time and effort into finding the right preceptors.
Right.
Because I had some really great preceptors, and one of my clinical experiences led me to my job that I now have. But then when I look back on other ones, I rushed it. It was kind of last minute, and it turned out really not to be that good of an experience. So one of the things that I would tell people is do your work early. If you know that you're going to need a pediatric clinical, next year, I would start doing that right now. Just because it's number one, it's hard to find preceptors, and number two, it's even harder to find good ones. So definitely do your homework early in terms of that, because ultimately that's just going to help you down the road. If you have a good clinical experience, and you have a preceptor that is good about teaching you and involving you in care. This may come as a shock, but my women's clinical wasn't as good as probably other people's was, just because of the situation that I was in. But definitely that would be the biggest thing for students. For RNs that are thinking about going back to school, or RNs that are already starting that process of transitioning to school, I would say you can do it. I think a lot of nurses that when I was getting ready to go to school, they would always say, "Oh, I don't know if I have the time to do it," or I don't think I can go back to school. It's been so long." You're never too old to go back to school.
Yeah.
There were people that were in my cohort that were, had been a nurse for 20 years. They'd been nurses for 30 years, and then they went back to school. My preceptor, that I now have this job with, he was a nurse for 20 years, 25 years, and then went back to school and got his nurse practitioner degree. So
Oh,
if it's
cool.
so if it's something that you are ambitious about, and it's something that you want to get into for the right reasons, I would encourage people to do it, because it really there really is a huge difference between being a registered nurse and then being a nurse practitioner.
There is.
And
Yep.
I think that the benefits of being a nurse practitioner are so worthwhile to take that chance on yourself.
Yep. Yep. I went straight from high school to nursing school, straight to my FNP.
Mhm.
And, there's always a little bit of a debate if people need experience or not. And honestly, because it is such a different role, I never felt out of place or like I was missing, except until I went into academia and was teaching undergrad, because it was a little bit difficult to relate like to nursing interventions, because again, my practice has been being a nurse practitioner.
Right,
I
right.
did work as a nurse while I was in grad school, but it was limited, obviously. So that was the only time that I felt like, I wish I had more nursing experience, was when I was talking specifically about nursing interventions and teaching, nursing undergrad nursing specific courses, but otherwise, it seemed to be an okay fit, and everybody's got their own journey. You know what I
Right,
mean? And it's not
right.
a bad thing to have experience either. It's a great thing. So everybody's journey, as long as it's your own individual journey and you are eager to succeed and taking the right steps that you need to be successful, it turns out. Preceptors, that's a good thing that you brought up as well. We're taking a very hands-on approach with preceptors. So making sure that people are in the right sites, actually doing that placement and making sure that it's the right fit. Because I do think that's essential. It's again, kind of what we talked about at the beginning of the podcast. You got to feel comfortable having conversation. So if you're with somebody that for whatever reason, you're not comfortable asking why they're doing something, or if something seems, different than the way the guidelines are, you've got to be comfortable in having those conversations, because that's how we all learn. So, yeah. Well, thank you so much, Nick. Anything in ending that you want to bring up, or anything else you want to mention?
I would just say to all of the students, both in the graduate program and the undergraduate program, it may seem like graduation is very, very far away and you're never going to get there. Trust me, it goes by faster than you think. So enjoy the time that you have with your classmates and with each other. And on graduation day, celebrate your accomplishments, because it is no easy task to go through whether it's nursing school or nurse practitioner school. It is a tremendous accomplishment, and you should be very proud of your success in academics, and know that you're graduating from a school that has prepared you to be successful in your profession.
Yep. I agree with all that too. So awesome. Thank you so much, Nick. It was so nice connecting with you, and so excited to watch you as you progress along your FNP career path. And I know you've already been very successful. So no doubt that you will continue to be very successful, but it was so nice seeing you again and connecting. So thank you everybody for tuning in, and I will see you on the next podcast. All right. Bye everyone.